Welcome back to Primetime News, and a special welcome to those of you watching online at onespotmedia.com. Jamaica now has 32 new confirmed cases of COVID-19, pushing the country's total to 105. 31 of the new cases have been linked to the Portmore-based Business Process Outsourcing Center, Alarica. That was revealed at a press conference a short while ago. The Prime Minister also announced a lockdown for the parish of St. Catherine. TVJ's Andrea Chisholm was listening and now joins us live. Andrea.
Well, Herman, the press conference is still in progress as we speak. We'll get to the lockdown a bit further, but first of all, let's listen to this announcement from the Health Minister, Dr. Christopher Tufton.
Jamaica can now confirm that we have 105 cases of COVID-19. This follows 32 new additions over the last 24 hours. The new cases comprise of 5 males and 27 females who range in ages from 19 to 70 years old. The cases are from St. Catherine, Kingston, and St. Andrew. They bring to 34 the number of cases under investigation. Of the remaining 71 confirmed cases, 31 are imported, 34 are contacts of a confirmed case, and 6 are local transmission. The vast majority of the 32 additions, indeed 31 of the 32, are linked to a call center located in the Portmore area, Alarica Intervention. This facility has a staff complement based on the staff registry of some 787 workers. We have so far in our intervention 258 individuals have been interviewed and sampled. 65 of those tests have come back, and of that number, 33 samples have come back positive. 2 were announced a few days ago, so 31 since today.
Now, the Health Minister also announced that steps are being taken to isolate the persons who have been confirmed with COVID-19. And in addition to that, the 237 persons who are employed to the St. Catherine Health Department has begun to do the contact tracing. And he also made this announcement regarding the recovery of COVID-19 cases.
In terms of recovery, quarantine, and isolation, currently 21 persons have recovered from COVID-19, 20 persons are in quarantine, and 65 persons are in isolation. We have now tested 1,290 samples, and of that, of course, we have had 105 confirmed positives, 1,185 negatives. Over the last day, we announced the mobilization of our mobile testing unit as part of the expanded testing efforts. And we have started in Clarendon in the Corn Peace area, and this will continue over the days to come. We have 5 such units, and those units are going to be deployed in the respective regional authorities to expand the collection of samples for testing. The actions to contain the spread of COVID-19 and to ensure the best possible health outcomes for infected persons continue to require our best efforts and all our efforts. The challenges in St. Catherine, we think, will continue for some time to come, and we intend to work, this is the public health infrastructure, to mobilize the all-of-society approach in order to contain what is an unfortunate situation.
Now, after hearing that news, Prime Minister Andrew Holness indicated that he does not want the society to panic at this time. What he said he instead is encouraging is that persons take responsibility. Now, Cabinet discussed the matter at length today, and the Prime Minister made this announcement for the lockdown in the parish of St. Catherine.
There will be a lockdown for the parish of St. Catherine, starting at 5 a.m. Wednesday morning, April 15th, 2020, through to 5 a.m. Wednesday, April the 22nd, 2020. That is a lockdown starting 5 a.m. tomorrow for the next 7 days, ending 5 a.m. on the 22nd of April 2020. What is the objective of the lockdown? The objective of the lockdown is to slow as much as possible the spread of the virus. The minister gave you some numbers as to the number of persons tested, and with 33 persons confirmed, you can use your own imagination to figure out how many persons have been contacted, the areas that people would have traveled to, and the potential spread that can come from that. So technically, you could be looking at as many as 1,000 persons contacted in close proximity. The effect of that is very great, and therefore the measure that we have to put in place is one that would seek to contain and slow the spread of the virus in a particular geographic area.
The Prime Minister also indicated that a cluster has been identified in the parish of St. Catherine as well as parts of Kingston and St. Andrew.
The reason why we are looking at putting in the lockdown now on St. Catherine is that we have done a GIS, that is a Geographical Information Systems, mapping of the addresses of the affected persons. And we are seeing where the addresses cluster. The addresses of the 300 plus that we have already mapped have clustered mainly in St. Catherine and parts of Kingston and St. Andrew. For Kingston and St. Andrew, we're doing further work. We have a further 300 plus addresses to map. And once we can fully identify the clusters, then other actions will be taken. So for St. Catherine, we know already that there is a massive cluster and that the spread there is particularly probable just by virtue of the existence of the call center in Portmore. People having traveled to the call center would have used public transportation, would have congregated in public areas. So there is a concentration there. So we have to start, and I want to be clear on that to the public. This measure is a start. And we're starting in St. Catherine, depending on what the other mapping of the addresses show and how the cases progress from here, then we will implement broader, tighter measures.
And the Prime Minister is also reminding everyone that if you have flu-like illnesses such as a cough or fever, you're not required to be at home. You should be at work rather, and you should stay home no matter how essential you are. So quite a lot to digest from that press conference, and we'll have more details in subsequent newscasts. Janella?